Hey everyone, welcome to a panel that is near and dear to my heart because behavioral health is really where my love for healthcare marketing just took off. When Cardinal started out, we were advertising and marketing for just about anyone and everyone, focused in on local. We got our foothold in healthcare, and one of our first clients in the space was behavioral, and it exploded, right? 2020 was a time where access was so important for behavioral health. And we were just fortunate enough to be along for the ride with some really great organizations that grew tremendously during the time. So I am very excited for the panel today with three of our guests. I'm going to go ahead and introduce them, let them introduce themselves to you, and then we're going to get into our conversation. So let me start with Kristin Garcia. Kristin works at Eleanor Health. Kristin, can you go ahead and just tell everybody listening a little bit about yourself and just about Eleanor Health as an organization?
Absolutely. Thanks, Lauren. As Lauren said, Kristin Garcia. I've been with Eleanor Health, which is an addiction treatment company, for almost 2.5 years now. Eleanor started back in 2018, 2019, and we are now in 7 states. We have clinics in 7 states, and we also serve the population statewide virtually.
Awesome. Next is Colin Jeffries. Colin is the VP of Marketing and Communications at BrightView. Colin, let everybody know a little bit about yourself.
Yes, hello everybody. Thanks to Cardinal for putting this on and for the opportunity to be here today. So BrightView does outpatient addiction treatment, primarily IOP, intensive outpatient, and then obviously OP outpatient. We have about 85, I think, centers in 7 states, about 25,000 patients under care.
Awesome. And then Michael Midgette of Thriveworks. Michael, new to Thriveworks, but not new to the space. So tell everyone a little bit about yourself, Thriveworks, and just your background as a whole in the space.
Yeah, no, happy to. I'm now in week 3 at Thriveworks, so ready for all the hard questions specific to Thriveworks. But Lauren, as you mentioned, I've been in behavioral health for quite some time, and healthcare for my entire career, intersecting with behavioral health. So I currently serve as the Chief Growth Officer for Thriveworks, and over the course of my behavioral healthcare career, have owned all aspects of business development, of marketing, of go-to-market strategy. And ultimately de novo expansion and mergers and acquisitions. At Thriveworks, so we are a national mental health care provider. So we provide outpatient mental health care. We do it both in person and virtually. So we have about 340 locations across 45 states. We have about 2,200 clinicians who are W-2. And we have a growing commitment to whole person healthcare, and not to the buzzword that we all like to use, but truly building out whole person centric models. So we can get into what that means from a marketing perspective, but super excited to join Kristin and Colin for the discussion.
Yeah, thank you guys so much for being here. I think the term mental health as a category is extremely limiting. It just kind of, assumes that y'all do such a small part of kind of the mental piece of it. And I think what's really interesting, you guys all have different titles: marketing and communications, acquisition and retention, and growth. We had a debate on our opening CMO panel this morning about marketing being a limiting term to categorize what you guys do. So I think today we'll work to kind of break down some of that, get a deeper dive into what you all do within your organizations, how you're driving success, and just overall how kind of that mental health becomes behavioral health, which becomes kind of whole person health. I think it's always interesting to start out by understanding where you guys see your biggest challenges to impacting growth. And then we can use those to kind of guide our discussion on how you solve those: technologies, strategies, people, ideas. So I'm going to kick it off with Michael. You're new, 3 weeks in. When we first spoke, you were 1. So you're in that kind of phase of, well, let me identify what the challenges are. Let me sit back, observe, see what's going on. Tell us what you've seen. What have been the biggest challenges so far?
Yeah, no, for sure. So I think first and foremost, a recognition that the biggest challenge impacting the growth of behavioral health and addiction treatment and the consumption of it remains the stigma. right? We've made so much progress over the last handful of years in reducing the stigma, but it still remains for a large percentage of those in our communities, and remains relatively unchanged for so many of the subpopulations of that big, broad behavioral health care term. And when we think about reaching out our hand via marketing and other channels, we still need to assume that the individual on the other side is not entirely comfortable with reaching back. Second, bad experiences with therapy, right? We've made great strides in expanding access primarily via virtual channels, but quality, for the most part, industry-wide, has not improved. And regardless of the source or corresponding percentage figure you subscribe to, the bottom line is that a majority of individuals who engage in initial care with a behavioral healthcare provider have already engaged with another one before. And we could have a whole discussion on why that is. But the reality is that there's a general dissatisfaction around the quality of care. And we, as marketers of these clinical products, have to understand that there is a hesitation there too. And no matter how high the quality of the care that we provide at our own organizations, assumptions are going to be made outside of our control before we even have an opportunity to have that initial conversation with the individual. And finally, just a thought on, quote unquote, growth of behavioral health services. It doesn't end simply with, that individual entering treatment, right? Clinical program completion rates remain incredibly low, and the attrition rate between sessions remains high industry-wide. So it's important to consistently meet that individual where they are that day or that week, understanding that our behavioral health is not a linear journey, right? We constantly, as marketers, have to be making that individual feel welcome, supported, and heard every step of the way through the care that we provide, but also through unique strategies of marketing and engagement throughout the entire journey for that individual, not just getting to them to the door for the first time.
And Michael, I'm gonna put a pin in that because I'm gonna come back to it. We talked in our we all got together before this to get to know each other and have a good conversation. And the journey, it doesn't end when they get in the door, and it doesn't start when they first make contact with you. It starts well before it. So we're gonna come back to that. Let's keep that thought in mind, everybody. Sure. Kristin, your title is acquisition and retention. So speaking to exactly to what Michael just mentioned, how your purview at Eleanor kind of touches that entire journey. What have been some of your challenges going through 2024 up until this point?
Yeah, well, I definitely echo what Michael said about stigma. That's a big one for us. We have a lot of people that come to us with medical trauma initially, and so building that trust is really challenging. We have to sort of prove ourselves that we're different. And so getting them in the doors is challenging in that respect. Once we do get them in the door though, yeah, so retention is key, right? Like Michael said, we know the course of a treatment, is lifelong, but you get the most benefit from treatment with Eleanor Health after you've been with us for, say a year. And then once you are through your treatment, it's all about maintenance, and it's all about maintaining that life of sobriety. And you don't want to feel like, you're just sort of, okay, well, you're done with your care plan, so good luck to you. So part of our, I know we talk about 2025 goals later, but part of our 2025 plans are to really focus more on the people that have gone through their treatment and making sure they still feel supported after they leave Eleanor Health.
And Kristin, do you think up until this point, the challenge or why that's a focus for next year, is it resourcing the team? Is it that you've had other major projects you've been focusing on? Like, is there something that you had to get done first before you can do that?
Yeah, 2024 was really about acquisition. We were putting a lot of effort into our tech stack and making sure we had the right processes in place so that as we're trying to grow and obtain new members, that's really where our focus has been in 2024. And now we feel like we're going into 2025 in a really good place where the beginning of the patient journey is is where it needs to be. So now it's time to extend that out to the rest of the journey.
Yeah, I love it. Such an important priority. I know data was big for you too. So it's like, how do I get the right foundation, right? So that when I build a house on top of it, it doesn't come crumbling down. That sustainable type of growth. Colin, would love to hear from you. Challenges, the biggest thing that you faced this year at your organization, impediment to growth.
Yes, well, Michael and Kristin and I are definitely facing some of the same challenges. One rock that doesn't seem to have been turned so far in this conversation is churn. So both patient churn, obviously, Kristin talking about retention, patient churn has been big for us. And then also provider churn. I mean, I think we've seen inflation drive a lot of people exiting healthcare jobs or lower paying jobs in favor of other areas where they can make more money. And we're actually seeing folks leave the field of behavioral health, or in our case, addiction treatment entirely, meaning they're not leaving BrightView necessarily and jumping to a competitor. They're just getting out of addiction treatment or of mental health or behavioral health entirely. And so that means we have to fill the pipeline more with additional talent. We have to invest more in training people and then making sure that we're actually bringing on the right type of person, the quote unquote BrightView person, because when you have an open seat and you can't treat patients as quickly or as effectively because that seat's open, and this can be a call center agent, right? We can't answer as many phones, or the hold times are longer because we don't have the person in that seat, or a therapist or an advanced provider. It can cover the entire spectrum. But then there's a little bit of pressure to just fill that seat instead of waiting for the right person. And so that's something that we're really trying to get our arms around, is how do we build the right culture to retain talent? How are we investing in that talent through talent management and upward mobility and those sorts of things? But I would say churn, both employee churn and like Kristin talked about, retaining patients have been a massive challenge for us year to date.
Lauren, can I just add one
And
quick thought?
yeah, please do, Michael.
So,
Yeah.
like Colin brings up a good point, which is just clinician recruitment. And I think the big one that we didn't, necessarily address head on is that there's a huge shortage of clinicians in the country, and that's going to impede the growth of the industry as a whole. Now, how do you expand access? It's going to be through junior level clinicians coming up through school. The biggest population growth within behavioral health by percentage are those, 50 and over. So there's a mismatch in ages, and when somebody engages in therapy, they might have preconceived notions, they might have hesitations if the person through the screen or on the other side of the table is a drastically different age than they are. So as marketers and companies, one of the things that we are going to have to really get thoughtful about is how do we promote and build trust in a very junior workforce that is supporting very personal care for those that are much older than they are. And I think that's one of those things that as time goes on, access will expand, but that will become more and more present in each of our lives.
And Michael, that's a perfect segue into kind of how marketers have to become more than marketers nowadays, right? I think solving the problem statement you just made requires alignment with the operations teams, really understanding how care, is being given, how to best position those younger providers as great options, how to bridge that gap. I'm curious, and I'll start with you because you brought it up. How are you working with kind of the operations side at Thriveworks to improve not only the front end acquisition marketing, but like we've all talked about, the retention, the alumni, the kind of continuum of care?
Yeah, so I think what it really boils down to, and like in my responsibility for marketing and business development, I fundamentally believe that the business development team in, the front end marketing function is, bringing that person to the door and giving our clinical operations like an opportunity. Right. And so whether it's a referral partner that is, taking a chance and referring to us, whether it's somebody coming to us directly, in which word of mouth becomes a very big thing and alumni becomes a very big thing, we're setting up that opportunity. So we need to make sure that we are deeply integrated with the operations so that we are taking the outcomes that they're producing and ensuring that their workflows are, one, producing the outcomes, but also we're showcasing the good work that they're doing. Ultimately, we're clinical organizations, and nobody, not to take away from this panel, people don't want to see my face. They want to see the clinician's face, right? They want to know what the clinicians are doing and the care that they're providing. And so we have to be deeply integrated as marketing teams into the clinical organization so that we are showcasing them appropriately. Because, and we can talk on and on about this topic on this panel, I'm sure, is we have to build trust in our organization before the individual even engages with us. And the only true effective way to do that is to showcase the clinical organizations in the operation. So us being fully integrated is incredibly important.
Yeah, and I think that's a great, we talked about trust a lot and this journey potentially starting before they ever even interact with us. I'm curious for all three of you, and I'll go around. When do you guys think kind of your patient journey begins? Like, what is the earliest point right now you believe your marketing function is able to reach a potential patient? And that, just because it is a certain way today doesn't mean it's not on your roadmap to change it going forward. But I'm curious, how your marketing function is kind of stepping into that trust building exercise. And Kristin, I know, a lot about Eleanor Health's kind of programs and where you guys are headed. So I'll ask you first.
Yeah, so our big focus the latter half of 2024 has really been to invest in SEO and content strategy. We understand that it's a very long lead time to get someone into our care. So we really have focused on creating informational content, answering people's questions, and trying to present, position ourselves as experts in conveying those clinical outcomes and telling people, we've seen these results. This is how we've helped people. Just really putting the information out there and letting them sort of research, get their questions answered, in hopes that eventually when they are ready to get into care or to schedule, they'll think of us and think of us as a really valuable resource that is a leader in the industry.
I love it. It's like that, put it out there and ask for nothing in return. And that kind of the reciprocity of that will be the long game.
Exactly.
And I think that's a great approach.
People are so used to convert now, click here, do this, give us your money. And really that's not what our organization, ultimately we are a for-profit organization, but that's not our primary goal initially.
Yeah, we had a presentation earlier today about an organization that kind of built a forum and community asking for literally nothing in return. There's no ads. This is powered by the company, right? It's branded its own thing. It's not meant to be a way to promote their organization. It just is for people to feel heard. And part of that ecosystem does come things like the referrals from friends and family and the online communities. And that's like that's the eventual benefit, but not why you do it.
Yeah, exactly.
So that's great. Colin, I'm going to ask you the same question.
Yes, absolutely. To build on what Kristin was saying, one thing that we found to be really interesting is more than 1/3 of net new patients at BrightView are coming in via word of mouth. And so what that means is we sort of have to coach, for lack of a better term, patients on what they should say about BrightView when they're in the community, when they're talking to friends, family members, people that they used to use with, et cetera. And so we have actually materials that we've designed specifically for patients to go give to friends, family members, et cetera. And those are available on the walls at the front desk. Their counselors can actually provide them for them, because oftentimes patients are saying, oh, I know someone who could benefit from this. And that's really scary, because that means patients can go out, and if they have a bad experience, we talked about operational alignment, if they have a bad experience with operations, if they have a bad experience with our patient access team or our call center, if they have a bad experience with our online chat, right, fill in the blank, there can be so many touch points where someone can have a negative experience. But we really have to be cognizant of ensuring that the entire organization is swimming in the same direction, so to speak. So that way patients are engaging with us through the entire process. They're hearing about us via word of mouth or encountering an online ad, or, Kristin talked about content marketing. They're coming across some of our content. And then we're walking with them as they engage with our chat feature online, as they click to call, as they perhaps read some of our content, as they follow us on social media, et cetera. And so making sure that the entire front end is built out for that patient experience. And then of course we can't lose it on the back end, or else we lose out on that 35+% of patients that are bringing in other friends and family members. So I think it's really key for us to recognize that we can't rely on patients to go out and say what we want them to say without us actually coaching them, without us empowering them with some materials, and those can be physical print materials or digital materials, et cetera, that they can go out and share and promote BrightView, because we want them to have a good experience and go bring other people in who will also have a good experience.
And organizations invest so much in building BD teams, physician liaison teams, creating materials for referring providers. Like, why not do the same for the other source of people that are going to talk about your organization? So brilliant. I love it. Michael, I want to hear from you as well. You know, where do you think Thriveworks is kind of able to reach the patient in their journey as of today?
Yeah, no, for sure. First, I want to underscore what Colin said, because that, like, it is trust is the biggest challenge for all of us in behavioral health, and establishing that trust. And typically there is no one more trusted than a family member, a loved one, whether it's somebody currently in treatment, whether it's an alumni. So I love what he said there. In terms of like the broader question of like, where does the patient journey start, right? When do we start building trust with that individual? They're forming those opinions. Their journey with us starts, even though it's indirectly, starts once they're hearing from a family member or a loved one, or even watching TV and seeing behavioral health care on TV. They're already coming to treatment or deciding on whether they come to treatment with these opinions about what it potentially is. So that's always a big challenge. And for us, right, it's important to call out, like, we're logos. We're not Dr. Jones with the community practice down the street, which can instantly be more personal just by the fact that it's a name. Right? So we have to be that much better with our brand voice. We have to be that much better with our imaging. And we have to be more thoughtful about making it real via patient testimonials. We have to get, former clients out front. We have to do all of those things so that they can say, I'm feeling what that guy said he was feeling. I want to have the experience that guy says he had with his therapist, because we as companies can do all the things in the world, but especially in behavioral health, it's incredibly important to bring kind of a different flavor of what Colin was sharing. Bring the individuals who are actually impacted, who are actually in it, bringing them to the forefront where appropriate. And if you have those conversations about, arming them to help other people the way that they were helped, it can become a very, very powerful thing.
And Michael, when we first met, we talked about a brand's USPs being a really important piece of that, right? Why would I choose you? You're a logo. Yeah. And you have to then really inherently understand the fears and the barriers and what motivates someone to seek care, whether it's, high acuity, low acuity, anything in between. I'm curious kind of how you think about really defining what makes you different and why someone would choose you, kind of in that show, don't tell capacity.
Yeah, in terms of like just generally like standing out from other providers, I think ultimately what it comes down to stand out is first a recognition that over the last number of years, especially, behavioral health providers have gotten pretty good about saying the right things, about bringing the right images. So for an individual, every company they're looking at kind of seems warm and fuzzy. They're all kind of saying the same things. So how do you differentiate between those? And then really thinking about like our different customer types, right? We as behavioral healthcare providers, we have different customers, we have different partners. Certainly the individuals entering treatment are one of those, but for most of our organizations, we're getting referrals from other places. There's alumni, there's, individuals that were in treatment that are referring people. So how can we make it objective? The way that we do that is via outcomes, and with an important recognition that different outcomes matter differently to different people. And this is one of my pet peeves, because I think that not just in behavioral health, but like all of healthcare, and particularly like VC and private equity backed companies get completely wrong, is that you go to their website and it's like reductions in total cost of care by this percentage, or reductions in inpatient admissions. And for an individual, that's a great outcome, right? The payers are going to salivate. Ultimately, what does that mean? It means that people are theoretically healthier on the other side, but that's not how the individual perceives it, right? So they actually are going to be turned off and say, I'm just being treated like a number in a game for all these guys to make more money. So you need to make sure that you have marketing strategies and channels that segment out these outcomes, right? The health system might be concerned about speed to care. They might be concerned about, retention in the clinical programming, program completion rate. And then the individual is mostly focused on things that perhaps led to bad experiences or they've heard in the past, right? What are those? Well, someone that didn't jive with their therapist and then they were just hung out to dry, right? Didn't connect with their therapist, dropped out of therapy, right? Didn't feel like they accomplished what they wanted to when they entered treatment. So those are the types of metrics that you want to have out in front of a patient. And then ultimately, you need to build an overall strategy because you can't perfectly segment. So like, who is your primary customer audience? What outcomes are you going to lead with, and which ones are you going to have segmented via different channels is extremely important, and it's very, very complex. But all that to say, behavioral health is so subjective, right? Even the insurance companies, we don't know what success looks like, and it's so hard to measure. And we could have a whole conference on why that is. I've got all my opinions there, but we need to be as thoughtful as possible about getting objective via measures that the audience actually cares about.
My favorite headline when I go in and audit like a paid search account, for example, is, 900 locations across the country. Like, what about that does a patient in a local community seeking to connect with someone care about, right? Really taking all of these things that we perceive to be the value of our brand and converting them into what we're really trying to say to an individual. So resonates absolutely. Kristin, you recently went through, I think, a patient journey mapping exercise. I know that was really important for you guys in setting the stage for next year. What did you learn from that? How are you using that to inform your priorities for next year?
Yeah, so we from a persona perspective have spent a lot of time understanding our different personas, to Michael's point, where people are in their journeys, how they find us, how they come to us, what they're looking for. First, we discovered that, and I think anybody on this call knows that this is true for their organization as well. We see people come through social media or phone calls months and months and months, if not a year, before they're ever serious about even connecting with us. So, the first lesson was how far out we have to start sort of speaking to people and communicating to people and educating people before they ever make a connection with us. When GA4 was still around, we saw people would visit the site, 2 to 5 times before connecting. We would see people calling us because we have call tracking metrics. People would call us and hang up before they even had the chance to connect with somebody. All that tells us, it's a really hard process for them to complete and go through. So ultimately, once someone does connect with us and they're ready to schedule a call, we need to make sure that we have the availability, that they can get in quickly because they've spent so much time thinking about it. And once they're ready to commit and schedule an appointment, we need to make sure we're there for them. They can access the care they need right away. And then, just continuing care, making sure they have the right care team in place. Michael mentioned whole person care earlier. That's our care model, is focused on harm reduction as a differentiator, and also wraparound services. So a lot of our competition really focuses on prescribing medications virtually. People are looking for their medications. It's really important that they get the medications they need quickly. But when someone comes to Eleanor Health, we know that their success is based on not just medications, but also peer support services, therapy services, and all of those services combine to create a comprehensive care plan. So making sure they have the different pieces of their care plan in place to be successful, and that they have access to the care when they need it. Yeah, I mean,
And
that's
Kristin,
sort of
what came first? Did the patient journey exercise come before kind of Eleanor's rebrand, or did you guys do the rebrand? Like, what's the right order to tackle those things in?
No, we did the research first, and we really fleshed out our personas first. I would say there was a time where we were trying to be everything to everyone, and that wasn't working for us. We were trying, and it came from a good place. We're like, we sort of broadened our
We can help
message.
so many people.
We
Like,
can help
we
so
want to
many
help
people.
everybody.
Yeah, we broadened our
Yeah.
messaging. Like, let's just get as many new members as we can. But at our core, we're an addiction services company. So that, like, we can't just offer mental health services to somebody that doesn't have anything to do with an addiction. But our thought is, we know that they co-occur at such a high rate that we were like, well, if we can get people in for therapy and then ultimately guide them toward addiction treatment, this will be great. Well, like you said, help so many people. But when there was confusion around our brand and our messaging, it wasn't serving anybody. So we had to go sort of backtrack and really be intentional about stating what our core services were, what our brand is, what our values are, and then moving forward with a more addiction focused sort of lens. Yeah, and that's where once we started changing our messaging, we did a website refresh. Then we were able to start moving our content in that direction. Our social campaigns.
I love that you started with the research, Kristin. It should be that way, right? And I think sometimes organizations say, I'm going to rebrand to what I want to be, and then I'm going to track it and see if people like it, right? And that's kind of the opposite way to approach it. So, yeah, just excellent work on that. I've seen kind of the brand transform over the year. It's been really fun to watch.
Yeah.
Colin, I'm curious, back to kind of what Michael mentioned, outcomes. And I know you guys have a lot on this front. How are you translating those into your marketing strategy? Like, what do they mean to your patients? What do they mean to your employer brand, to your referring kind of provider networks? How does it all package together?
Absolutely. What we found from doing surveys, interviews, I'll say structured and unstructured interviews, and focus groups with both patients and referral partners is that they care about very different sets of criteria. That's no surprise, right? Patients really care in our business about how fast can I be treated and what are the barriers to service. And they wouldn't use words like barriers, but they want to know, I don't have insurance, can you help me? I have Medicaid or Medicare, can you help me? I don't have a car, can you help me? I need to be seen today. Like, we're in substance use disorder, withdrawal symptoms are terrible. And so people want to know, hey, I'm in withdrawal. My options are either go out on the street and get something to help me feel better, or I can go into a BrightView center or a competitor and try to feel better. But they're so used to being hung up on, to being told we have a wait list, to being told come back next week when our provider's in town, to being like they hear all sorts of these hangups. And so for us, when we're talking to patients, we're using leading indicators that have been well researched. For example, a new patient can walk into a BrightView center. So they're not scheduling online. They're not calling to schedule. They're literally walking in, and they'll receive medication within 4 hours. And that's a brand promise that we live and die on, because, and I know for those of us who are not in substance use disorder, 4 hours sounds like a long time. Like sitting in my dental clinic for 4 hours is a lifetime. But from a substance use disorder perspective, again, our patients are used to being told our prescribing provider is here on Tuesdays from 10 a.m. to 11 a.m. So you have to come back next week. Not at BrightView. At BrightView, you can walk in Monday through Friday and you'll get medication within 4 hours of walking in. That's something that's really important. And we did a lot of research to make sure that we could live on that promise, because what we didn't want to do was say, you can walk in and be seen and receive medication within 2 hours and have the average actually be 4.5 hours, something like that. So that's a huge brand promise. That's kind of a leading indicator. And then our referral partners, so think about drug court judges, veterans court judges, emergency room discharge managers, et cetera. They want to know how long are people in the program. So when we're talking specifically to drug court judges, parole officers, sheriffs, et cetera, we have a longitudinal data study that we did over the course of 2022 and 2023, measuring things like how many days does our average patient spend in jail based on their substance use disorder. And we're tracking that longitudinally. So we can go to, again, our justice system partners and say, hey, when you refer a patient to BrightView, average time spent in jail decreases by 50% in the first 90 days. And we look at things like arrests. We look at, for our more medically inclined referral partners, we're looking at things like how are they doing on the PHQ, patient health questionnaire? How are they doing on the GAD, general anxiety disorder scale? And we're tracking all of this data and then sharing that with them so that way they have a very reasonable expectation for what patient outcomes are with BrightView. But again, we have to segment and recognize patients care about basically one thing, which is how fast can you help me feel better? And referral partners care about much different things. And we're even segmenting referral partners by type. Justice system cares about arrests, time spent in jail, et cetera. But our medical referral partners care about different things. Is that patient seeing a dentist? Is that patient getting involved with a primary care doctor, et cetera? And we're able to have definitive data, again, based on a year-plus long study that says, here's what you can expect when you send a patient to BrightView. And that allows our business development team to build meaningful relationships, to build trust. And kind of going back to, I know we've talked a little bit about, I don't know if we've used the word therapeutic alliance yet, but trust really underpins the success of therapy and of medication-assisted treatment in our case. So being able to make those promises with patients and referral partners respectively at the front end and then fulfill them in an ongoing capacity is absolutely crucial for customer experience, both B2B and B2C.
And Colin, while we're on this topic, because I know you just went through some work in the talent side, the recruitment side, and the provider shortages, the burnout, the career changers, people leaving the field altogether has been an issue. How does that data kind of, and those insights play into then what voice and message you use in your employer brand?
Oh, it's a great question, Lauren. So I'm a marketer by training and by background. And so I'm constantly data, test and learn, hypothesize and adjust. And so what we found with basically BrightView's effective marketing strategy is you go out, you stub your toe a lot, you burn some things down and you figure out, hey, this doesn't work and these things work. And you keep testing and iterating the Sean Ellis growth hacking model, if you will. And so what we did is we applied again, I've been at BrightView for about 6 years, and we've been doing research with patients, with referral partners the entire time that I've been here. And so what we did in probably November, December of last year is we took the marketing hat and then put it on an HR lens. And what that looked like is we were interviewing people that had recently left BrightView. Are you staying in the industry? Are you leaving the industry entirely? Are you going into an adjacent healthcare field? We also talked to people who recently joined BrightView. Why did you join? Help us understand why you're passionate about this job. How long do you intend to stay? Asking some tough questions. And then, of course, we were interviewing people that were both happy and moderately unhappy in their roles at BrightView. And that led us to really understanding how we can create a value proposition for employees. We call it our EVP, employer value proposition, that resonates with the kind of people that we want to hire and employ for a long duration of time at BrightView. It's a tough industry. We're seeing a very acute, very difficult patient population. There's not a lot of attaboys, right? There's a lot of I think about drug court judges and parole officers. Why is my report late? Where's my report? I need this on this patient, right? Like, screw your documentation, give it to me immediately. So there's a lot of those types of conversations. And what we wanted to do is really flip it and focus on the benefits of working at BrightView, of working in substance use disorder treatment in general. And that led us to an entire employer value proposition that resulted in rewriting job descriptions, that resulted in a lot of talent management infrastructure that we're building out, that resulted in programs where now folks can come in as a front desk person. We call them PSRs, right? Patient services representative. They can go from a PSR to an ops coordinator to an ops director. And there's now a timeline where they can look at it and go, oh, I can build my career at BrightView. It's not just a job. And we've done the same thing with our patient access team. They start as call center agents and they can progress in their career as well. So that's been something that's been immensely powerful, I think, for us as we're trying to look at people leaving the field entirely, people who are facing burnout or flame out, or I'm sure we've all heard the old adage, quit and stay, right? Like we really want to avoid that because, again, our work is very meaningful. I'm very passionate about it, and so is the rest of our team.
Yeah, I mean, one of the things we've noticed throughout, getting together, this community of people is how passionate, you guys all are. So I love the fire. I love the hands. I love, just how much it means to you guys. I could sit and talk to you guys forever. I think there's like 2 more pages of prompts up on the screen that I'm not going to get to, because I want to be conscious of time. And I want to understand kind of a closing question to you all. And Kristin, you alluded to this earlier. Top priorities, whether it's, time or dollar investments going into next year. And I've asked everyone as we're closing these out to toss in, if you have one, a favorite tech or tool, so that the people listening can kind of, think about what they might want to add to their stack for next year. And no big deal if one doesn't come to mind, but if you have one, toss it out there for the group. Kristin, I'm going to start with you.
Yes, so I did mention 2024 was sort of about cleanup, putting tech in place, putting processes in place. I think our goals for 2025 are to focus on, now that we have tracking and data in place, which Cardinal was a huge part of, helping us get Mixpanel installed once pixels were no longer a thing. And we've got a great dashboard that you guys have built. We also have a lot of data we finally have put together internally using Tableau. So now we have so much more transparency into how people are converting, how long people are staying with us, why they're converting, why they're leaving. So we'll be really focusing on digging into that data to further enhance acquisition strategies, retention strategies, the member experience. With that, I think it will be really important to everyone sort of touched on like outcomes. I think we need to do a better job of getting that data out there to all the different audiences, to prospective members, to referral partners. We have some data on outcomes. I think we could do more. We could show more, and really just expand the trust in our brand over the next year. Yeah, those are the big ones, I think.
Yeah. Awesome. I swear I did not ask Kristin to give Cardinal a plug, but thanks for the shout out, Kristin.
Yeah, of course.
Colin, I'm going to ask you the same question. Top priorities and or investment areas for BrightView going into next year.
Yeah, so if anybody was on the panel or tuned into the panel previously with Adam and I forget the other gentleman's name, but they were talking about same-store sales growth, a retail term for basically centers or locations that have been open in an existence on the previous year. And so that's really what we're focused on in 2025 is same-store sales growth. And I'll say not all growth is created equal. We're analyzing excess capacity, looking at staffing to patient volume to what we're considering unassisted patient growth, meaning if I don't do any marketing, if I don't do any business development at this location, just based on word of mouth and existing referral relationships, how much does that center grow? And then how does that correlate to unused staff capacity? I wish we had tons of unused staff capacity at most centers, right? But unfortunately, the environment we're in, we have certain centers where driving additional patient volume to those is much more valuable. So we're really focused going into 2025 on same-store sales growth. Don't kick me off the panel for this, Lauren, I hope. But
I will not. It's the end anyways, Colin. So you got nothing to lose.
True. That's true. We've spent the last probably 4 or 5 years at BrightView building out a very robust marketing tech stack. So, Monday.com for project management, Canva Pro for quickly editing videos, Premiere Pro for editing longer form videos, Hootsuite, Chatmeter, right? I could go through the list of things. I feel really good about where we are technologically, but one thing that we're really looking at investing in 2025 is humans. And so really bringing in experts in the field to mentor and help our team really take it to the next level is key. I think we're in a good position from a tech stack perspective. We're migrating a lot of our dashboarding into Looker BI. And so we're getting really hands-on with the data and the technology, but being able to bring in that human touch for improved storytelling, improved effectiveness, and just making sure that we're focusing, as we say in behavioral health, we're practicing at the tops of our licenses, right? Like we're doing the things that matter the most. So I'm excited for what 2025 has in store, and to bring in some people that are better than us to really upskill the team.
I love it. And hopefully, the community, couple hundred people here today, tap into that, ask around for the talent, the mentoring, the consultant that people are using. That's what this is all about. So I think it's perfect. And Michael, you're going to bring us home here on focus for next year.
I'll quickly bring it home. So a lot of things going on, but Salesforce Marketing Cloud, Salesforce Marketing Cloud, Salesforce Marketing Cloud. Like you heard it through the discussion across a variety of different questions, and that is, how can we more effectively engage an individual from the moment that they referred through well into their alumni journey? How can we better engage with referral partners, right? How can we use the data in our existing systems to inform those marketing journeys? And what we've found is that Salesforce Marketing Cloud is an immensely powerful tool. Of course, like all Salesforce, you can customize till the cows come home, so you can just keep going and going and going and going. But it provides a phenomenal foundation for us to engage with value. And then one other thing we're focused on is getting far more sophisticated and thoughtful about our proactive marketing and engagement. And what I mean by that is behavioral health, like the majority of healthcare, is very reactive, right? People aren't engaging. We're not marketing until somebody is really struggling with a problem. We need to, for example, I came from kidney care. When somebody's kidneys fail, it's called end-stage renal disease. End stage, for God's sakes. It doesn't scream you should be optimistic. Depression rates are extremely high. How can we work with nephrologists to make behavioral health a part of the discussion in preparing them for what's to come with kidney disease? Same thing for oncologists. Same thing for, you name it, right? A lot of comorbidities. We have to get better as an industry, as marketers, at engaging folks before these significant challenges really build and arise in their lives. So big focus of ours.
I love it. Thank you guys so much for joining us. Salesforce, I'm coming for you for some sponsorship money for all the times I've heard you the shout outs on this, but clearly it's the best. So I'd love to hear what you guys are using. Kristin, Colin, Michael, thank you guys so much for joining us. I wish we had another hour together, but we'll have to do it again soon.
Thanks,
See you guys.
Lauren.
Thank you
Thanks
so
for
much,
joining.
Lauren.
Guys.